Glaucoma. Glaucoma overview. Glaucoma is a disease of the major nerve of vision called the optic nerve. The optic nerve receives light from the retina and transmits impulses to the brain that we perceive as vision. Glaucoma is characterized by a particular pattern of progressive damage to the optic nerve that generally begins with a subtle loss of side vision, peripheral vision. If glaucoma is not diagnosed and treated, it can progress to loss of central vision and blindness. Glaucoma is usually, but not always, associated with elevated pressure in the eye, intraocular pressure. Generally, it is this elevated eye pressure that leads to damage of the eye, optic nerve. In some cases, glaucoma may occur in the presence of normal eye pressure. This form of glaucoma is believed to be caused by poor regulation of blood flow to the optic nerve. Types of glaucoma. There are many types of glaucoma, but the two most common types are open angle glaucoma and closed angle closure glaucoma. Open angle glaucoma, also called primary open angle glaucoma and chronic glaucoma, accounts for 90% of all glaucoma cases and occurs when the trabecular meshwork becomes blocked and the fluid can't get to the normal drainage canals. This blockage results in fluid buildup and intraocular pressure. The fluid buildup happens gradually. Closed angle glaucoma, also called acute glaucoma or angle closure glaucoma, accounts for about 9% of all glaucoma cases and occurs when the opening between the cornea and iris narrows such that the fluid cannot get into the trabecular meshwork and normal drainage channels. This narrowing results in fluid buildup and intraocular pressure. The fluid buildup happens very quickly. Other less common glaucomas include normal tension glaucoma. Optic nerve is damaged even though intraocular pressure is consistently within a normal range. Congenital glaucoma. Incorrect or incomplete development of the eye's drainage canals during the prenatal period. Childhood glaucoma. Open angle glaucoma in infancy, childhood or adolescence. Secondary glaucoma occurs as a result of eye injury, inflammation or tumor, or in advanced cases of cataracts or diabetes. Symptoms of glaucoma. Known as the sneak thief of sight, open angle glaucoma has no early warning signs or symptoms. However, as the disease progresses, a person may experience tiny blind spots appear at the edges of the visual field, peripheral or side vision, that slowly get larger and spread. Blurred vision, appearance of colored halos around lights, adjustment problems on entering a dark room, repeated difficulties that new eyeglass prescriptions do not help. Peripheral side vision is decreasing. The symptoms of closed angle glaucoma are severely blurred vision, severe eye and head pain, nausea or vomiting, appearance of rainbow-colored halos around bright lights, rapid loss of vision. Causes of glaucoma. Several factors that can put a person at risk for developing glaucoma. Family history of glaucoma. There is a 20% chance of developing glaucoma if a parent had it and 50% chance if a sibling has it. Age. If the person is 65 to 79 years of age, there is a 3% chance of developing glaucoma. If the person is 80 years of age or older, there is a 14% of developing glaucoma. Medical conditions such as morning headaches, diabetes, lupus, abnormal eyesight, Crohn's disease, rheumatoid arthritis, myopia, nearsightedness, and high blood pressure. Use of topical steroid prednisone or cortisone medications. Abnormally high intraocular pressure, previous eye injuries, recurrent blurry vision, pain around the eyes after watching TV or leaving a dark theatre, seeing rainbow-hued halos around lights at night. Peripheral side vision is decreasing. Treatment for glaucoma. There is no cure for glaucoma, but there are treatments for glaucoma and they fall into two categories: medication and surgery. Both of these treatments for glaucoma manage the disease by lowering the intraocular pressure. Medications and eye drops are common remedies, but there is the possibility of side effects and they may eventually become ineffective over time. If the IOP cannot be managed by medications or eye drops alone, surgery may be recommended depending on the type of glaucoma. The surgical goal would be to drain the intraocular fluid by expanding the existing drainage area or by creating a new outlet for the fluids to drain through.